contact lenses are worn by about 2 in 10 people. And we do have a lot of contact lens related issues that come up. So contact lenses are essentially made up of either silicone or hydrogel materials. They're semi-permeable, permeable lenses, which go on top of your eye. So they are a substitute to glasses, and they're usually worn by patients who do have a small number or a big number, and they're not very comfortable with the glasses. And those are some of the cosmetic indications for wearing contact lenses. One may also have certain therapeutic indications for wearing contact lenses, in the sense that there are certain eye conditions like keratoconus, where we actually give patients rigid gas permeable lenses to treat the eye condition. We use them in patients who are not very tolerant or not very fond of glasses, or for cosmetic reasons, or for actually treating certain eye conditions. Generally speaking, when you go to a contact lens clinic or to a practitioner who will then help you to come to a decision as to which lens is absolutely suitable for you, depending on your requirements. So there are some people who absolutely do not want to wear glasses and they want to use the contact lenses almost the entire day. And so for them, daily disposables then becomes a good option. For the ones who want to use contact lenses occasionally and don't want to use them daily, they're happy using the glasses daily, you can have the monthly pack where you use it and then leave it, you use it and leave it, but it then lasts you for that month. The most important thing here while using contact lenses, I would feel, is that you have to be very particular about the solution, the lens cleaning solution, the fact that you're not supposed to sleep with the contact lens on in the night, and the fact that if you have any symptoms of redness or foreign body sensation or blurry vision, you must visit your eye specialist immediately. Please do not ignore those symptoms, because that could mean an infection. The commonest problem here is that this takes a little bit of practice. And when patients are starting off on their contact lens journey for the very first time, this really needs to be talked about, and this needs to be taught to patients, because this is the most important part. So first step is literally washing your hands very, very carefully, adequately, and never ever touching the contact lenses without washing hands. A lot of the times, women especially are using eye makeup while putting the lenses on and off. So it's really important that you don't touch makeup and then touch the contact lens, because then that way a lot of foreign particles and eye makeup is going into the eye. So step one is wash your hands really carefully, really thoroughly before touching the contact lens. Take it out of the solution, preferably stand in front of the mirror when it is your early days and when you're getting used to wearing contacts. And you do one eye at a time in front of the mirror. You can choose to look up or down depending on the comfort level. And once the lens is of the proper fit, it is very easy to get in. When you close your eyes, it shouldn't feel like there is something poking you, or there is something in the eye. A well-fit contact lens should not give you foreign body sensation. And the same thing is done for the second eye. Ensure that lens always goes back into the lens cleaning solution. Replace the lens cleaning solution frequently. Do not reuse it. If there is a point where you have had infection in the eye because of contact lens, which we call contact lens keratitis, then you need to throw away those contact lenses and the lens solution. We usually send it to the laboratory to check, and you need to get new lenses and new solution if you've had an infection with that batch. So these are some of the precautions. And as I'm repeating myself, but as far as the don'ts are concerned, an absolute no-no is sleeping in with the contact lenses, using them overnight, or using them beyond their prescribed prescription period. Like if they're daily disposables, they need to be thrown at the end of the day. If they're monthlies, then they all have an expiry period, and that should really be adhered to very strictly. age goes here, because there are so many do's and don'ts, and because we want you to be really responsible about the contact lenses, we generally recommend it for older teens, or maybe say after 18, because then patients can take responsibility for the whole cleanliness aspect of it. It's difficult for younger children to use and manage all these aspects of contact lenses. So yes, I would say maybe after 18, 19, that would be a good age to sort of start using contact lenses, if at all. However, having said that, there are certain diseases, certain eye conditions where we are prescribing contact lenses to younger children, even babies, actually. But in that case, then their parents really do take up the onus of ensuring that everything goes by the book, you see. A lot of patients that we see who do use contact lenses on a daily, weekly, monthly basis, they sometimes do come with, a fallen contact lens or a stuck contact lens. One of the commonest things that happens is patient has taken off the contact lens in one eye, and they feel like, the second eye contact lens is not coming out, it is stuck, and then they start feeling like there is something inside, and then they go poking and prodding that eye. That is the absolutely worst thing that you can do to the eye. So if you feel like the contact lens is inside the eye or it is not coming out, please do not rub the eye. Do not go fishing in the eye or poking in the eye, or try to sort of jiggle your finger inside the eye, because what that does is it damages the cornea quite a bit. Please see your nearest eye specialist in that case, because then what we do is we use a stain, a fluorescein dye. We get you to sit at the machine and we actually look inside the eye for the lens. In most cases, it has fallen off and there is nothing in the eye, but there is a little bit of swelling, which then causes that foreign body sensation. So yes, it is possible that the lens folds on itself and gets stuck under the upper lid or the lower lid. But then at the machine, in the hands of a specialist, it is a really simple procedure to remove it. But if you rub the eye, touch the eye too much, or try and remove the lens yourself, then you may end up hurting the eye or harming the eye. The other thing that you can get with contact lenses is contact lens keratitis, which is an infection of the cornea, which is the front transparent layer of the eye, because of contact lens use or because of a small infection in the contact lens. So there is an organism called Pseudomonas, which is very, very common. Commonly infects these lenses when they're kept for a very long time, especially in a hot and humid country like ours. See, so the best thing here is, if you have any redness of the eye or any foreign body sensation of the eye when using contact lenses, again, you must see the specialist, because when on the machine we put that fluorescein dye and stain, if the corneal ulcer or the infection is very tiny, if it's less than 1 millimeter, then we can treat it with drops alone. But if you ignore it, and if it becomes larger in size, if the ulcer becomes larger than say 2, 3, 4 millimeters, whatever, then it needs a hospital admission. Then we have to scrape the ulcer, and then it becomes a much more complicated procedure, which can then lead to scar tissue formation in the eye, in the cornea, and can affect vision. Main purpose of using contact lenses here is to get rid of the glasses. So most patients don't use both. But yes, there are certain exclusive instances where there are patients who have now reached 40 and 40 plus, and at that age patients start getting near glasses. So after the age of 40, patients need presbyopic correction. It is called presbyopia, where you need glasses for reading near things, and in that case, if there are certain patients who are used to contact lenses and are very happy and comfortable with contacts for distance, then they may use glasses just for near work, or maybe when looking at your phone, or when reading something off the computer or something like that. In that case, we discuss these things, these requirements with the patient, and they can get something like progressive glasses, where then you don't need to use contact lenses, or we just give them a small reader glasses, where spectacles, where they just use those for near work and they're still using the contact lenses for distance work. This pretty much happens in patients who have a very high minus or a high plus number, and having both the numbers in the same glass makes it a bit bulky as well as a little bit difficult, because there are these optical aberrations that happen when you have very high plus or a very high minus number in the spectacles. So for those patients, contact lenses are actually much more comfortable than glasses. When you put the contact lens on the cornea, which is the clear part of the eye, it literally blocks off, to a certain extent, the oxygen supply of that membrane of cornea. And cornea, as you know, so the eye needs oxygen. All the layers of the eye also need oxygen. But the cornea, which is the absolutely front clear window of the eye, that gets its oxygen from diffusion, which is a process where oxygen is dissolved in the tear film, in the tears, and it gets oxygen via diffusion from there. What contact lenses do is they cut off that oxygen supply. And when cells or, when living organisms, they don't get oxygen, there's going to be cell death. And that's exactly what happens when you use contact lenses for an extended period of time, where these cells actually are deprived of oxygen and there is cell death. So there is bits of the cornea actually get destroyed, or those cells die, and then they that makes it more prone to get infections. And that's how you actually then get these secondary bacterial infections and corneal ulcers and things like that. So it's weakening the corneal membrane, it's weakening the cornea, it's reducing the the natural defenses of the body if you use those contact lenses overnight.